Hello, it's Nicole, afternoon drive host on 92.5 XTU.
And Marisa Magnatta, producer of Preston and Steve Show.
And we are so excited to welcome another ridiculously smart person to this wonderful video.
Our trend around here.
That's our trend. We talk and then we have smart people on to chit chat with us about important things. So Dr. Samuel Weiner, and the title is the Vice President of Clinical Operations for Virtua Medical Group. Thank you so much for joining us.
It is my pleasure. I'm happy to be here, Nicole and Marisa. Thanks for having me.
Thank you. All right. So let's just get to the bottom of this. We got to talk about COVID. We got to talk about Omicron. I think everybody is kind of shocked and just exhausted about what's going on. And so let's just start from the beginning of if people are not feeling good, because it is flu season, it is cold season, and we have the pandemic raging on top of that. So what are some of the symptoms that people can look for? And then what do they do once they feel like they might have it?
That is a great question. Right now, there are a lot of other things out there other than COVID. However, there is a lot of COVID out there. I'm not going to pull any punches here. Omicron is everywhere. And so any sort of symptoms that people have that involve their respiratory tract. So I'm talking a runny nose, stuffy nose, a sore throat, certainly a cough or chest congestion, certainly a fever. You have to have some suspicion for a COVID infection and really kind of treat it as COVID until proven otherwise. So the very first thing for you to do if you're not feeling well, isolate yourself from everybody else. Keep your mask on, but go into a part of the house if possible where you're not going to be around others. Don't share meals with other people and reach out to try to get a test one way or another.
That's my hell right there, not sharing meals with anybody. Yeah. I have to ask, so there is probably no Instagram post that's going to tell me whether I have COVID or the flu, correct?
That is correct. No matter, there is no list of symptoms I can tell you that says, oh, this means it's COVID, this means it's the flu, this means it's the common cold. There is so much overlap. It's just right now you have to go with the assumption that anything that's causing you not to feel well very well could be COVID.
Yes, I think that's such a good point, and not enough people are doing that. I had COVID about a month ago, and as soon as I had a fever, I happened to be at home at my parents for Thanksgiving, and I was like, Mom, you got to get a test. I know I have it. And she's a teacher. She's been teaching this whole time. She's like, Nicole Ann, I don't think so. And I go, yes, because to me, I just assumed, and I had a cold twice before that. I always assumed that I had it. But then I had another really good friend who was like, oh, I think it's the flu. And I'm like, and then she was like, I lost my taste of smell. I was like, lady, come on. So I think that's great advice. Just assume you have it at this point, and then process of elimination from there.
Yeah, that's exactly right. And as you may have heard so far with Omicron, we're seeing overall maybe some less severe cases of it. So there is a lot more people just walking around with a stuffy nose or runny nose, and they may be apt to otherwise just say, it's just a cold, I'm just going to keep pushing through. You really should not be doing that at this point.
And so what's the process if you do believe that you have it? How do we reach out to Virtua and find out, do we need to get tested? Do you just stay at home? What do we do?
Yeah, so again, I think the first imperative is that you make sure that you're isolating yourself from other people, and then reach out to your healthcare provider, reach out to your primary care physician, and kind of try to get some advice about what to do with your symptoms and where you can find testing. It's no secret that right now a lot of the home testing kits are sold out. They're unavailable. You go to a pharmacy and they've got signs in the front door saying that we don't have any home testing kits.
I was going to ask if you had any.
I actually have one in my house that I bought 2 months ago, and I'm glad I did. But yeah, so a lot of the home testing kits, if you can get your hands on one, absolutely, that's great. But a lot of, if not, there are a lot of sites that you can go to, be it pharmacy-run sites, be it your local hospital system, your local doctor's office. Many places now are offering PCR testing, but you just understand that there is such a demand right now that there may be a little bit of a wait for you to get that testing. So in that interim, while you're waiting, again, it's important, hunker down at home, separate yourself from other people, use whatever you would use to try to kind of reduce your fever and body aches, and just get that test, whenever you can.
Well, yeah, and I think too, it just came out that with Omicron, the at-home test, the rapid test, seemed to be less accurate than the PCR test for this particular strain. Is that true? Do you know why that is?
Yeah, so I can't speak so much as to why that might be, but what we really worry about are what we call the false negative tests, right? So that would be you do a test at home and it says you're negative. That may give people a false sense of kind of security that,
Yeah.
oh, well, it's not COVID, I can go out and do other things. We are seeing some false negatives out there, and so really the at home test, if it's positive, you can believe it. If you're positive and you've got symptoms, there's a really, really good chance you've got COVID. If it's
Mine
negative,
light up like I won a contest.
Like a pregnancy.
Like
Let's
a
be honest,
pregnancy.
like a pregnancy test.
Yeah, mine was like it's like wait 15 minutes. I was like, I guess I don't have to.
It's pink.
Yeah.
right. But on the other hand, if it's negative, I don't want people to think that, okay, well, now I'm in the clear. If it's negative, you really should continue to isolate yourself and try at some point to get yourself a PCR test, which is one of them that's offered through pharmacies or at your local doctor's office or hospital system.
Okay, so there's a question if you've been exposed, how many days it takes for your symptoms to show or for you to test positive. Is there any specifics to that?
Well, what we're generally seeing, the trend right now is that with Omicron, we are seeing people develop symptoms a little bit quicker than what they had in the past. So it can be as soon as within a day or two after exposure. However, if you're at day 2, day 3 after you've been exposed and you're not symptomatic, you're still not in the clear. It could be up to a week, even 10 days after an exposure for the symptoms to come on.
Yeah, that's what happened to me. So I actually have no idea where I got it. No one that I knew had it. And then everybody that I infected, it wasn't until almost a week later that they got their symptoms. So it was really interesting, but it leads me into the question about vaccines. So I was vaccinated, but I wasn't boosted yet. Everybody that I was around who was boosted didn't get it, but the people that were vaxxed but not boosted did get it. So the question is, if you're not vaccinated and you get COVID, how long should you wait to get vaccinated? And then the other part of it is, if you're vaccinated but not boosted yet, how long should you wait to get your booster after having COVID?
These are all great questions. So,
Lots of
the cut and dry answer there, if there is one, is that we generally recommend that you wait at least 2 weeks after a COVID infection to get an immunization. So whether that's starting your first series or that's your booster, we recommend that you wait at least 2 weeks. There is, however, a fair amount of data out there that says that you're protected by natural antibodies after an infection for up to about 90 days. So really anywhere in that 2 week after infection up to 90 days, that's the sweet spot to either go out and get yourself your initial 2 shots or to get boosted.
So we're saying get boosted, get
Yes.
vaccinated. These are the messages that are out there.
The data, as every day that goes by, the data is becoming more clear, especially with Omicron, that having those initial 2 shots, yes, you are technically fully vaccinated, but you are nowhere near as well protected as you would be if you got that booster shot. It is right now more than ever important that you get the booster.
Yeah, I keep saying that I'm a science experiment, that everybody I exposed who was boosted did not get it, and everybody who was just vaccinated got it. And fortunately, it was pretty mild. There was like 2 days where I was like tired, a little nauseous, never lost my taste or smell. But I'm like, I can't imagine if I wasn't vaxxed what I would have felt like. So yeah.
Get vaccinated.
Yeah, you are the walking embodiment of what we're seeing right now, Nicole. Absolutely. Your story is very typical.
The only time I've ever been average. There's nothing average about me except for this.
All right, I have one more confusing question that we need help with. Can you explain the new CDC guidelines about quarantining? How long do you need to quarantine after you get your test or you don't feel well? What do we do?
Yeah. So again, first thing, I can't say this enough. Until you get your test, if you're not feeling well, you got to isolate yourself. You got to stay away from others. So what the new data is, or what the new recommendations are telling us, that if you're symptomatic and you test positive for COVID-19, that after 5 days, so on day 6, after you started to not feel well, you could come out of your isolation. You could come out of your house. However, for those next 5 days, so up until you get to 10 days out of from your initial symptoms, it is so important that you wear a mask in every situation. You should not be going out to a restaurant where you have to take your mask off to eat. It's 5 days of isolation. Sorry about that.
All good.
Sorry about that. It is 5 days of isolation, followed by an additional 5 days of wearing your mask at all times around other people. And there's a little caveat to this as well. All of this is predicated on the fact that you're afebrile, so you don't have a fever anymore, and you're feeling better, right? So it could be day 7. If you're still feeling lousy and running a fever, you should not come out of your isolation. So that 5-day guidance is only for people who are not running a fever and you're feeling much better.
So there's one thing that's been consistent the entire time we've been experiencing COVID-19, and that it's different for everybody. There's no regulations, there's no rules. It's not treating one person the same as another. It's different for every patient.
It really is. There is no guideline that's going to cover your particular circumstance. You really have to let your body be your guide. And the rule of thumb is that if you're not feeling well, no matter what the guidelines say, you should not be around other folks.
Yeah. So what are the best ways to stay safe? Let's say you're one of only a couple people left who has not gotten it. This girl, knock on wood. And there's like a handful of people that I know. I'm like, how did you skip? What kind of vitamins are you taking? So if a handful of people who have not gotten it yet, how do you? Or let's say a lot of times you're seeing people got it like last year and now they're getting it again. So what are the best ways, say the top 3 ways to stay safe going into this crazy, flu COVID season?
Yeah, what I'm going to tell you right now is not going to be anything earth-shattering. The
Right.
number one way to stay safe is to get your vaccines, and if you've gotten 2 shots, to get your booster. Again, I cannot overstate the importance of having your booster and the impact it has in protecting you. But my number 2 and my number 3, again, you're not going to want to hear this. It's wearing a mask pretty much as much as you can when you're in a social situation, and it's hand washing. If we continue to do those things, it's going to give you, it's not 100% guarantee, but it's going to give you the best possible shot. And look, we're coming up on the 2-year anniversary of this pandemic hitting our area. We are all exhausted. I'm exhausted. But right now, with Omicron and how infective and infectious we're seeing that this variant is, it is more important than ever for us to continue to be vigilant, wear the mask as much as you can, wash your hands as much as you can, and try to ride this out until we see that it's starting to wane.
Yeah, we agree. I mean,
Yeah.
both Nicole and I, reside in Center City. And so there's never been a time where we haven't been wearing masks.
Yeah.
And when people around us don't wear them, it's actually
Weird.
almost uncomfortable for
Yeah.
me sometimes, because I'm just used to wearing it all the time. And so thank you for preaching those words.
Yeah.
Those are what keep you safe.
And thank you to all of our healthcare providers. You're literal superheroes. Dealing with this as long as you have. They're the experts. They're the ones that go to school that study diseases. We're very grateful for Virtua that we have such a great partnership. And for more information, appointments, doctors, all the good things, you can just go to virtua.org.
Thank you, Doctor. Please thank all of your coworkers on our behalf.
I will. Thank you so much for getting the word out, Marisa and Nicole.
Thank you.
Thank you.
All right.
Stay
Bye-bye.
safe.
Yes.